Trix Ingado, KTN News.
Now today, Kenya joins the world to mark the International Pharmacist Day, and the theme this year is Pharmacy, Strengthening Health Systems. This morning, we look at the role of pharmacists in the global health, achieving global health, and case in point right here in Kenya, achieving the government's, the ambitious universal health coverage. In studio, I'm now joined by Dr. Bethuel Libea. He's a pharmacist and also consultant. He's just seated next to me, Libea, consultant at the Pharmaceutical Procurement and Supply Chain Management, while at the far end is Dr. Misha Korio Odenyo, a pharmacist once again and official at the Pharmaceutical Society of Kenya. Thank you so much, gentlemen, for being here.
Thank you.
Yeah, and we're having this conversation at a time when I would say it's a crisis in the pharmaceutical industry right here in Kenya. Conversations of even doctors advising patients not to do over-the-counter because of the quacks that we have out here. So it's going to be a very interesting conversation, because how do you know that this pharmacy is headed by a qualified pharmacist or not? But anyway, let's begin by the day itself, the World Pharmacist Day. What is the significance of this day? What the challenges that we are seeing here in Kenya, for example, on the quacks and over the counter? Was it the agenda that brought medics together and said, you know what, let's have this day to sanitize the sector? Let me begin with you, Dr.
All right, thank you.
Yeah.
Thank you so much, Purity, for having me on this particular discussion. And today is a special day for the pharmacy fraternity, if I may put it that way, because we are celebrating World Pharmacist Day. And this day specifically is to amplify the significant role that a pharmacist plays in the entire healthcare ecosystem. And you've mentioned most specifically here in Kenya, because if you look at a pharmacist among the 33 plus cadres of healthcare professionals, it's one of the highly trained professionals. They are one of the highly trained professionals, but also highly underutilized. And most of these problems is systemic. Systems have been crafted in such a way that the pharmacist is not utilized to the best way they're meant to be utilized. And the repercussions of that, it's visible for everyone to see. And you've captured some of them. We have the issue of quacks in the market. We have the issues of drugs being misused. We have issues of antibiotics being misused, because people who then end up handling medication, most of them may not necessarily be qualified professionals to do that. And so having this day is to amplify the voice of a pharmacist, to amplify the significant role that they play, and also to let the public know that we have these professionals that can help you as far as your medicine needs are concerned. So this is the significance of this day. Yes.
Right. And before we get to who a pharmacist is and who is a qualified pharmacist, because he mentioned that pharmacists are highly unutilized. We are seeing pharmacies mushrooming everywhere in the city, up country. When you talk about being unutilized, and there are so many pharmacies in the country and across, until most patients don't even go to the hospital, they just go and they're prescribed over the counter. Maybe you can elaborate on, when you talk about being unutilized, what exactly does he mean, really? Yeah.
Okay, thank you once again for inviting us to the studio today to talk on this issue about the Pharmacy Week. As my colleague has just talked about, pharmacists are highly underutilized. If you look at the cadre and the knowledge of pharmacists that we have in the country, there are quite many who can be used in strengthening the health systems in the country. So you find that, just as my colleague has said, the problem is systemic. And one of the ways of maybe addressing this is maybe to see how the regulations can be put in such a way that we can be able to control some of these, like you said, quacks. And it has become so much of a trade until the pharmacy practice itself has been neglected. So that is why we are here to amplify that and to let the public know at least what is happening in the pharmacy field and what the pharmacists are doing in terms of trying to strengthen the health systems. Yes.
Yeah, and Dr. Bethel, there's always a concern in the health sector where when you look at, for example, the education sector, you see that the teachers are united under a cadre and there's the Teacher Service Commission. But when it comes to health sector, everyone speaks for themselves. For example, the nurses will say, this is what we do. The doctors will say the same. And they'll even issue a statement that there was a time the doctors issued a statement that the nurses felt that, the clinical officers felt that, you know what, I think they are undermining our role. And the lack of unity among the health cadres brings the problem. Yeah. So what exactly is the problem or the main issue around the pharmaceutical industry in the country as we speak?
All right, thank you. I think that is a very important question, and I'll say that there are several answers to that.
Yeah.
And you've captured correctly that we have sibling rivalry among the healthcare professionals, but what unites us, or the convergence point of all of us, is to see that the patient is well taken care of, despite our differences. But having said that, if we take a look at the pharmaceutical industry in Kenya, there are several challenges that the profession is facing, both from within and without, because I'm sure you've heard about this out there, that there's money in medicine. And so even people who do not have a background in pharmacy or any training in the pharmaceutical industry, they want a stake of this particular cake. So everybody is pulling the rope to their side. And we look at the professionals themselves. We have two cadres of practice in Kenya. We have the pharmacists, who have also done the degree, they've been trained at the degree level. And then we have the pharmaceutical technologists, those who've done diploma in either pharmaceutical technology or they've done diploma in pharmacy. So these are two siblings under what we call pharmacy practice, or pharmacy practitioners in Kenya. So the older siblings are the pharmacists, and then the younger siblings are the pharmaceutical technologists. But at the end of the day, both professionals have a clear scope of practice based on their training. That I've been trained as a pharmacist, and this is my scope of practice for the safety of the patient, so you don't cross borders. And then also, same applies to the pharmaceutical technologists. You've mentioned about doctors issuing a statement and clinical officers coming up in arms. Most of the time is always around the area of scope of practice, which needs to be really made clear, because at the end of the day, when scope of practice is put in place, is for the safety of the patient, so that I don't end up practicing something that I haven't been trained to do, exercising it on the patient. It may end up harming them. So it's just there to safeguard the patient. And there are challenges that come with that. Of course, people may feel that this scope of practice is sort of barring me from doing this and this and this, which isn't the case, because at the end of the day, as I mentioned before again, is the safety of the patient. Now, moving out of the pharmacy practitioners, we look now at the industry at large. There are many things happening at the industry. And as I mentioned before, that pharmacies are highly underutilized, and there are efforts that are being made to try to rectify the systemic errors that have been there before. For instance, the case of, maybe just to add to the question that we had asked him, add something on that. When you walk into any public facility, chances are high when you get to the counter where you need to get your medicine, you'll be given your medicine, but the person will hand over the medicine, will spend as minimum time as possible with you, simply because the queue is long and the place is understaffed. So when we have such a scenario, the pharmacist or the pharmaceutical technologists at the counter or at that particular facility may not have adequate time to address your case and still be able to clear the line, you see. So the systemic problem that we experience there is understaffing. If we have enough pharmacists in public facilities, then it means they are able to put into practice, spend sufficient time with the patient, and put into practice the pharmaceutical knowledge to ensure that pharmaceutical care is actually delivered, which is not happening. That's a systemic problem. Two is the issue of employment of pharmacists. When you look at the number of pharmacists trained in Kenya, it's not that we are in surplus, but we'll find many unemployed pharmacists, simply because the public system or the facilities or hospitals haven't really appreciated the role that pharmacists play. And so they think pharmacists, their work is just to dispense medicine, which really goes beyond that. dispensing medicine is only a fraction of what a pharmacist can do. It goes beyond that.
Yeah, and you'll be telling us what the role is. But the infighting within the healthcare sector, is it the one causing all this problem that you're not able to, for example, here in Kenya achieve the universal health coverage? Because I'll give you an example. If I go to the hospital and the doctor tells me, make sure you do not buy over-the-counter medicine. And like you said, the role of a pharmacist is not just to dispense the medicines, but that is what literally we know the role of a pharmacist is. So can again a pharmacist, for example, prescribe a drug to a patient, and when the doctor says that, it means that there is some lack of trust that you might go over the counter and you're given drugs that are not appropriate. So how can this be resolved so that medics work in unity and their value is appreciated as well?
I think one of the ways in which this can be addressed is through the regulations. You find that the current regulations that is being used in the country, which is called CAP 244, was developed in 1956. And since then, there have been a lot of developments in the medical sector in terms of the drugs that are out there, how they are dispensed, and things like that. So one of the ways of trying to regulate this is, like my colleague has just said, we need to have proper laws in place that specify what a pharmacist does, what a pharmacist technology does, so that there's that clear delineation. Yeah, because you find like right now there's the Kenya Drug Authority bill that is being discussed in Parliament. I think as the Pharmaceutical Society of Kenya, our leaders have canvassed this a lot, and we want to thank you, the media, for always coming and inviting pharmacists, or when we are having our meetings, at least helping us to highlight this. So currently, as we are trying to draft the new regulations, you find that there are a bit of challenges that are there. And some of these regulations that the pharmacists are trying to bring in, it's not rocket science. It's not something that we're developing from ourselves. You find that these are international best practices, So you find like whatever the government is trying to implement, like the universal health care, the sustainable development goals, there's the issue of every person has to have the right for higher standards of quality. So this is where we are trying to, as a pharmacist, to lobby the Parliament. At least they can draft this bill in such a way that it will be progressive. Because we have pharmacists who have a lot of knowledge, we interact with our partners outside the country, we have development partners, we have policy makers, and some of the proposals that the pharmacists are giving are based on these discussions that we've been having. And if Kenya is to move forward and have better healthcare, better medicine regulations and the use, I think it's important that this bill is critically looked into, and the stakeholders, whatever stakeholders are bringing on board, to be taken in and adopted in the country. Otherwise, we'll have that revolving problem of always having medical issues, medical prescriptions, and things like that.
And Dr. Libea, the public continue to lack faith in the pharmaceutical industry. Recently, it was big news. The Pharmacy and Poisons Board did recall a medicine. We know that that was initially used to relieve pain among the children. It was recalled because of concerns from the public. These concerns are not from the pharmacists or the society or even the procurement and management chain. They're from the public. So why is this happening in the industry? Is it because we don't have qualified people, for example, in charge of these medications and even ensuring that the procurement is properly done? Or what? And it's not the first one. I think it's almost the 9th this year. So why is this happening?
That's a very good question. It touches on what we call pharmacovigilance. And I'll be delving into that, and maybe just to break it down for people to understand, it's actually part of what we call ensuring that the drugs that are out there, they are safe, efficacious, and of good quality. But maybe before I address that, maybe I can add a thing or two to what he has mentioned about the challenges you are facing. You are sent by a doctor, you are a patient, you are sent by a doctor to a pharmacist, and you are advised do not get this and this and this. And I think what is lacking in the space of medical practice in Kenya is what I call collaborative practice, where a pharmacist collaborates with a medical doctor to treat one patient. And there's a model that currently is being worked on. Of course, it has worked elsewhere, what we call medication therapy management, which is, in short, is called MTM. It has been used in the US, UK, and we see that collaborative practice where you as a patient, when you visit your doctor, there is a contact between your doctor and your pharmacist. So when your doctor sends you to the pharmacist can get back to your doctor and communicate regarding your needs, medicine needs, and advice that this medicine and this is not appropriate for this patient because of this and this and this. And that works well for the patient. So that is also a model that we are looking to put into practice in Kenya to try to solve that push and pull that happens between a doctor and a pharmacist in that case. Now, to the question you've asked about recalling of products, and I mentioned about pharmacovigilance. If we look at what we call the life cycle of a product, of course, it begins with development, and then there is the manufacturing process and all that. By the time a product is given what we call a marketing authorization, that is simply permission to market it in a certain country or a certain market. It means it has passed all the quality checks. But once it's out there, it has to be monitored. Is it really meeting the standards? And problems can come either through storage, through transportation, that may now affect the quality of the product by the time it gets to the intended user. So, for instance, the case of that particular painkiller, I won't be able to mention the company or the brand name, but in the case of that painkiller and many others that have been recalled, is not that there was laxity with the regulator. It's part of what we call pharmacovigilance, where you and the Pharmacy and Poisons Board has that particular portal or a form where you as a patient, you can actually fill information in case you buy a medicine and you realize it's giving you some side effects that are not captured in the leaflet or is not up to the standard quality that you expect. You are able to fill that information in and send to them, so they'll do their own investigation, and if it's critical, they'll have to recall it. So it's part of ensuring that medicines that are out there, they are safe, efficacious, of good quality. It's no cause for alarm.
Yeah,
that's how
I put it. Doctor, thank you so much, especially on the touching on the storage of medicines, because I almost asked about that. So you've all, the two of you, agreed that there is a sibling rivalry within the healthcare sector, and it's majorly the root cause of all these problems that we are seeing, because there's no coordination, there's no cooperation. You had quickly talked about the Kenya Drug Bill, the Kenya Drug Authority Bill, for example, that is before Parliament. So, I've heard pharmacists and even experts saying it's going to be a game changer in the drug in the medicine industry, because this getting rid of the cartels in the industry and ensuring that the quacks, for instance, are not part of the negotiation. So maybe you can tell us more about the bill, the KDA bill, and what it aims to achieve. Yeah.
Okay, thank you for that question. The Kenya Drug Authority Bill, it's a regulation that seeks to better enhance the regulation of not only medicines, but of chemicals, things like veterinary products, medical device. Because you find that the scope of pharmaceutical services is sort of expanded, And that is why we are saying we are trying to hold discussions among the industry and the stakeholders to be able to ensure that these regulations that are out there and we are benchmarked against are incorporated into the current bill. So you find that currently the bill that is in Parliament mostly is sort of, we can say it's more of trade related. When you look at some of the proposals that have been put across, you find that we need to have technical people in technical areas. Like, for example, you find that the proposal for the regulator that is being proposed right now, you find that the pharmacist is not in the middle of all this. You find that engineers maybe have also been part of this, and this is what is causing the problem in our country. You find that, for example, something to do with pharmacist, it's been watered down to say that pharmaceutical special technologies or something. There's that clear delineation. There's a problem there, and that's what the pharmacy practice and the pharmacy profession is really trying to to push for the country to adopt.
Yeah,
for us to have better regulation in terms of the medicines. And this will also bring in campus cosmetics, because I think cosmetics there are some therapeutic cosmetics which are currently not regulated. We have chemicals in some of these which can harm the patient and things like that. So all these things need to be under proper control, and that is why we were saying the pharmacist's job goes beyond dispensing. There is so much more in which a pharmacist can play a role, and that's what we are fighting for. And just one last point is that we are trying to see whether this Kenya Drug Authority bill, they can change their name into Kenya Medical Health Products and Technologies, so that it can encompass all these therapeutic classifications, and we are able to develop a bill and an act that will drive the country forward in terms of regulations of medicine. Because as the government is also trying to boost local manufacturing of medicines, which is very good, and these are some of the areas that as pharmacists we are trying to push, to have that local self-sufficiency. And I think a case in point is the COVID-19 pandemic. I think it brought to fore some of the challenges that most countries are having in terms of having that self-sufficiency. So you find that the pharmacists are trying to put in place structures whereby the government can support the local industry so that we can also be self-sufficient and can be able to meet the medical needs of the patients. And as a result, the universal healthcare coverage will be taken into consideration. Thank you.
All right. Dr. Libya, let's talk about who the role of a pharmacist. Actually, we see chemistry in hospitals and outside there in the market. So should we believe all of them, for instance? Who is a pharmacist and where can we find them? Yeah.
All right.
Yeah.
That's a good question, Purity. Thank you so much. And the role of a pharmacist is diverse. The role of a pharmacist is diverse, and it's unfortunate that most people in the society look at a pharmacist as that person who sits behind the counter to dispense medicine.
Right.
But really, that's really a small fraction of what a pharmacist does, because our training is vast. It covers a big area, and perhaps I'll mention quite a number of them, and then delve in on the aspect of chemists. How do you tell this is being managed by a pharmacist, or this is being run by a pharmaceutical technologist, and this is being run by a quack? Because it's really important. I've had friends who've gone to, who don't have a background in medicine or pharmacy, who've gone to facilities to get medicine, and yet how they prescribe, when they call me, they tell me, I've been told take this medicine, this man. I get surprised because they've been given an overdose because they've gone to a facility that is not being run by a professional. And so looking at the roles of a pharmacist, the chemist is one of them. That is what we call a community pharmacy. That's the chemist, a community pharmacy. You will walk into a pharmacy, you find a pharmacist there, they'll give you the medicine and take you through the instructions, because that is a really important aspect of pharmacy practice. Taking the instructions on how you're supposed to take your medicine, any anticipated reactions, side effects, is really important that you get that information as a patient. The other area of practice is at the hospital setup, and mostly you'll find them from level 4 going onwards, especially those that have inpatient services, because pharmacists play a critical role in patient management teams, looking at treatment sheets, advising on dosages of medicines and all that. They help the medical doctors and all those who are part of the patient management team. We go to the industry side, where we have these drugs being manufactured. And at the industry side, it cuts across, because we have different departments in an industry and different areas of specialization. There's a production pharmacist, there's one who is in charge of quality, there's one who is in charge of regulatory affairs, the laws and the guidelines, others in charge of marketing. So it's quite an array. And then you come now to public health. And then under public health, you can talk about many things. Public health systems strengthening to ensure that the healthcare system is strengthened. We have other specialists in what we call health economics and health finance who are pharmacists. We have others who are in supply chain. I'm a consultant in procurement and supply chain. So that is another area where pharmacists plays their role. We have others in research who play a role in research. We've talked about clinical trials. these medicines before they get to the market, they have to undergo clinical trials, and pharmacists are needed in that particular space. So those are some of the roles that pharmacists play in the entire healthcare ecosystem.
All right.
And now when you talk about chemists, you are a patient, you walk into a chemist along the streets or in your estate, and you don't know how to tell whether it's being managed by a pharmacist or a pharmtech. I'll give you, or I'll share three things or four that one should look out for. One, when you walk into a pharmacy that is being managed by a pharmacist, there should be a green cross somewhere. A green cross, because a green cross is one of the requirements that the Pharmacy and Poisons Board requires that the pharmacies that are being managed by a pharmacist should have before they're given a registration or license. So there should be a green cross visibly displayed. For a pharmaceutical technologist, there should be a blue cross. Yes, for pharmaceutical technologies, there's a blue cross. Pharmacists, there's a green cross. And also that will help you tell which pharmacy is being managed by who. And then two, it's required by law that license for the person who is practicing there should be visibly displayed. The license, practicing license, the registration of the pharmacy should be visibly displayed. So when you walk into a pharmacy, you should be able to see it displayed on the wall and be able to read the credentials of the person managing the facility. Three, there is what we call health safety codes that the Pharmacy and Poisons Board gives that are displayed in retail facilities. So when you're able to send those health safety codes to the number that is always provided in that particular sticker in each facility, you should be able to get a response that this is a registered facility and is being managed by this person. And lastly, on the Pharmacy and Poisons Board website, it's possible to check actually the list of the facilities that have been registered and who is managing them. So if you log onto the pharmacy, you don't even need to log in, but you just search the Pharmacy and Poisons Board website, you'll be able to look at the professional's name, and if the registration number has been displayed there, you're able to check it out online, and also the name of the facility to tell you this is a registered facility. Right. Yes.
And Dr. Odenyo, what is the Pharmaceutical Society of Kenya doing really? Because I think you are an umbrella body for the pharmacists to ensure that there is public trust as far as the industry is concerned. Yeah.
Okay, yes, the Pharmacy Society of Kenya has been very active on this front in terms of engaging the government, parliament, stakeholders, policy makers in trying to ensure that there is better regulation, yeah? And we've had some of our members...
And would you say there is better regulation now?
There is better regulation, but it needs to be strengthened. Yeah. And not only strengthened, you see, the health sector is really moving at a very fast pace, yeah? You can look at what is happening in the US concerning the AI and new things coming up, yeah? So if you look also on the pharmacy sector, there are things like biotherapeutic medications which are coming, biological drugs. You see, these are things which can only be handled by a specialist pharmacist who has been trained. And when you look at the scope in which pharmacy has evolved, you find that these days we have pharmacists who are, like my colleague said, medicine therapeutic management. You find that there are pharmacists who are specialized in hypertensive medicines. You find that there are pharmacists who are specialized in diabetic medicines, those kind of cadres. So this is what we are trying to push in terms of increasing the role of pharmacists and giving more access to pharmacies. Yeah. Because I think also when the devolved government came, you find that our laws still remain the same. Yeah. And that is why sometimes we have challenges maybe in the counties in terms of employing pharmacists and ensuring that pharmacists are in each and every sector, in the hospitals especially. Because I think it is a common knowledge most of the time when we interact with patients. For example, when you're dispensing a medicine, yeah, you'll try. A pharmacist does not just sell for you that medicine. A pharmacist will talk to you, will try and ask you, what has the doctor told you? And I can guarantee you 90% of the time, the patients don't know what they've been prescribed or how to do it. And you see, it is that pharmaceutical knowledge that will be able to guide these patients. So that, for example, there are some drugs, probably if you take a way of excretion is maybe the urine will be orange, or maybe when you go to for a long call, your feces will be black. You find that these are things that pharmacists already have that knowledge, yeah? And instead of a patient panicking, it's the pharmacist who can be able to come and tell the patient, okay, this is just this is not a side effect, this is not a bad, this is just part of the execution of that drug.
Yeah,
and one major important thing that we also want to highlight concerning the Kenya Drug Authority bill is that to get hold of the problem that you're seeing, the sibling rivalry and things like that, the Pharmaceutical Society of Kenya is trying to push for a pharmacy practice bill, which a proposal has been made, and I think also this has been submitted to Parliament. And we are really asking the parliamentarians to take this seriously, because if we don't put these regulations in place and these specializations and people to do the jobs that which they are trained for, this is an effort in futility in terms of improving the healthcare of the country and being able to give patients the quality of medicine that they deserve, that are safe and efficacious.
All right, and time is not on our side. We have to wrap it up now, but thank you so much, Dr. Bethel Libea, for being here. Also, thank you, Dr. Mesha Kodenyo, for making time for us. I wish you all the best in your campaign today.
Thank you very much.
All right, that brings us to the end of the News Center this Monday morning. Thank you for watching. I'm Purity Musianzuki. Keep watching KTN News, and God bless.